Okay, let's talk about drug therapy. The first thing you need to remember when you're talking about medical treatments for mental illnesses is that mental illnesses are no longer thought of as being possessed by the devil or God, but now doctors understand mental illnesses as illnesses with symptoms, and mental illnesses require diagnosis and treatment. So there's a big analogy between the way doctors treat mental illnesses and physical illnesses. The focus is on diagnosis, making sure that you understand exactly what the problem is. Researchers in the biological bases of mental illness focus on looking at genetics, but also neurotransmitters and brain pathways. Usually they recommend pills, medication. Every once in a while now, if medication doesn't work, they're increasingly starting to recommend some brain stimulation. And we'll talk about both drug therapies and brain stimulation therapies. There are 4 broad categories of medications that are used to help people with mental illnesses. The first one is antidepressants, and they are prescribed for people who are struggling with depression. Also, they're used with people who have bipolar disorder to try to deal with the depression there. Sometimes anxiety is treated with antidepressants. And some common brand names that you may be familiar with include Prozac, Paxil, Wellbutrin, Lexapro, Cymbalta, etc. There's another class of drugs called anti-anxiety drugs, and they're used to treat anxiety disorders. And the names there include Xanax, Valium, and Ativan. Mood stabilizers. The idea of a mood stabilizer is to help people with bipolar disorder, right, where you have the ups and downs of emotion. A mood stabilizer tries to take the edge off of the mania and tries to keep the depression from getting quite so bad, so it stabilizes moods. Lithium is still used actually quite a bit as a mood stabilizer. And there's a final class of medications called antipsychotic drugs. They're used to reduce psychosis. And remember, psychosis is when there's a break between how you experience reality and how other people do. Antipsychotics are used with bipolar disorder and also schizophrenia. And common names of antipsychotic medications include Haldol, Seroquel, clozapine. Okay, let's talk about antidepressants. Antidepressants are typically given for several months, say a year. Sometimes people are given antidepressants for a very, very long time. There's some controversy about whether that's a great idea. It's not entirely clear how antidepressants work. Originally, people assumed that antidepressants worked by changing neurotransmitters, that is, the chemicals that neurons use to talk to each other across synapses. So, for example, a common type of antidepressant is called an SSRI. SSRI stands for selective serotonin. Remember serotonin, the neurotransmitter? Selective serotonin reuptake inhibitors. And SSRIs basically are like shutting down recycling. Instead of adding more serotonin, they just stop the recycling of serotonin so that it hangs around in the synapse longer, stimulating the receiving neuron more. That was the presumed mechanism by which antidepressants were thought to work, and some of their effect may still be through the neurotransmitters. But there's this big problem. Antidepressants take usually about 2 weeks before they start to have their effect, but they change neurotransmitters almost immediately. So that's a problem to understand. So researchers now are working on a different idea. Maybe antidepressants work by promoting something called neurogenesis. Neurogenesis means the birth, genesis, the start, the birth of new neurons. Now, in the old days, neuroanatomists, neuroscientists would tell you that you cannot grow new neurons, but now there's a whole field called neurogenesis. We know better. Now, why neurogenesis and antidepressant? Well, neurogenesis in humans takes place, as far as we know, largely in the hippocampus. And if you remember patient HM, the guy who had his hippocampus removed on both sides to treat his epilepsy, the hippocampus is a brain area that we need to create new long-term memories. HM, couldn't create any new memories. It turns out that people who have been suffering from depression for a while, the size of their hippocampus actually gets smaller. And we also know that people with depression have trouble remembering things. Students who are clinically depressed really struggle. They'll study and study and study, and what they're studying doesn't stick in their heads. So some psychologists think maybe what's going on with antidepressants is that they are helping the hippocampus get a little bigger, to grow more neurons. We're not sure yet, but lots of research is going on. Antidepressant use is very common. You can see here, these are rates of antidepressant use in the U.S. About 13% of adults in the U.S. take antidepressants. That varies both by gender and by age. So women are more likely to take antidepressants than men, and older women are more likely to take antidepressants than younger women. How effective are antidepressants? That again turns out to be a complicated question. You remember the placebo effect, right? If you think you're being helped, you are. Well, it seems like the placebo effect plays some role in antidepressants. And that makes sense because, frankly, the placebo effect is found in every medication that there is, whether it's heart medication or antidepressants. And research seems to suggest that antidepressants have a bigger effect than the placebo effect, especially for people who are the most depressed. So for people who are the most depressed, they get the most benefit from an antidepressant. What drugs are used to help people struggling with anxiety disorders? Well, anti-anxiety medications. A very common one is something called a benzodiazepine. That's a class of medications that are mild sedatives. The idea here is that anxiety comes from an imbalance with GABA, which is the primary inhibitory neurotransmitter in our body, right? So GABA is what we use to go to sleep, to rest, relax. Without that GABA, you can't rest, you can't relax, you can't sleep. So anti-anxiety medications increase the effectiveness of GABA. They are faster acting than antidepressants, but they come with a cost. There's been a lot of addiction associated with anti-anxiety medications. So that's why sometimes now people are treating anxiety disorders with antidepressants, because antidepressants aren't addictive and anti-anxiety medications are. So anti-anxiety medications include Ambien, Ativan, Halcion, Lunesta, Paxil, Valium. Another class of drugs, mood stabilizers. Again, these are used primarily to deal with major shifts in mood. So remember bipolar disorder. People go from being manic to being depressed to being manic again. So the idea with a mood stabilizer is it reduces the variability. So the highs of mania are not so high and the lows of depression are not so low. Lithium is often used, but people who use lithium have to be very careful and measure their liver enzymes a lot, because if somebody isn't careful, lithium could cause some liver damage. Schizophrenia and to a lesser extent bipolar disorder are associated with psychosis. So the final class of drugs that we're going to talk about are antipsychotic drugs. These are used to treat hallucinations and delusions. And they work by blocking dopamine receptors. So the idea with schizophrenia is that there's too much dopamine in the system. Antipsychotic drugs work, we think, by lowering the effectiveness of dopamine in the brain. And it does work for about 60 to 70% of people. And antipsychotic medications include name brands like Abilify. Drug therapies do not work as well by themselves as they do in conjunction with psychotherapy. So a lot of times psychiatrists will prescribe medication for you, but they insist that you also see a psychologist or a counselor, so you get the talk therapy plus the drug therapy, because the combination works better than either one alone. And that's been shown in multiple studies.